So how does Hi-VNI technology and precision flow in particular help our workflow in the ER? In my opinion, it's the easy button of treating respiratory distress. The reason for that is we really only have 2 cannulas that we need to fit in our ER. So we use either adult size or pediatric adult small. We do have some very small babies, and that would be the exception. But again, that is the exception. Most of our ERs, unless you're caring for a NICU population, are just not going to see patients that fall outside of those categories. It's the easy button because these folks can eat and drink. They can take their oral medications. They can move about. They can go to CT or X-ray on the therapy. They don't have to be fitted for a mask. They don't have to worry about skin breakdown or leakage or a lack of a seal on the mask. We don't have to worry about facial structure or beards or what have you in terms of fitting the technology to the patient. It's super easy. It warms up in just a few minutes, and the effect is almost instantaneous. So within about 5 minutes or so, you're going to know if this is going to work for your patient. Hi-VNI technology in my clinical practice is kind of a game changer. The thing that I really like is that nobody brings me new equipment in the ER. You might think that's incredible, but most of the things that we get are hand-me-downs from other departments, or they've been tested and tried and used in the ICU or in the pediatric units or somewhere else before the technology came to me. So I think it's kind of cool that I have the latest and greatest to apply right in the emergency department. This is not something that I have to get permission to use, and it is widely acceptable at this point through our hospitals. Similarly, because the patients are getting Hi-VNI technology initiated in the ER, it kind of carries through their admission. It's not something that they're going to move to a different part of the facility and get changed over to something else. Most of our respiratory staff, our critical care docs, our pediatricians, they're all very comfortable with it now as well. And so you're seeing more and more of its use. Why? Again, it's really well tolerated. It's super simple to use, and the patients like it. We wouldn't sacrifice how effective the treatment was. And so we're seeing similar results. The other thing is, these folks do not have to go to the ICU in most part. Now, if they're comorbid or if they have other things going on besides their primary respiratory issue, of course they're going to go to the ICU. But our hospital supports use of precision flow on the floor, and so a lot of these folks are cared for there. My internal medicine colleagues, if they have people that deteriorate on the floors, if they develop respiratory distress on the floors, we're also seeing them use precision flow as their primary means of resuscitating these folks. They're no longer intubating them quickly. They're no longer using positive pressure in any way, but instead going to Hi-VNI technology, which has benefited their patients as well.